Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you the 3 distinct reasons the intensive care team doesn't want you to question their approach or have peace of mind, control, power, and influence. You can check out last week's blog if you're clicking on the link below this video. In this week's blog, I want to show you a 5-step blueprint for dying well and with dignity in intensive care. Having a loved one critically ill in intensive care is one of the most stressful events during your lifetime. This is even more true when your critically ill loved one is in one of the most difficult and challenging situations there are in intensive care, such as when they are very unstable and in a very critical condition, or if they are in a life-threatening situation, or if they are in intensive care for long-term treatments and long-term stays, or if they're having a severe or traumatic head or brain injury, or if they are approaching their end of life in intensive care. And what about if your critically ill loved one is inevitably dying in intensive care? Let's face it, you and your family are facing your worst nightmares. And death is obviously not a sexy topic. Death is not a topic society wants to talk about. Death is not something that fits well with our perceptions about youth, vitality, and health. The reality and the truth of the matter is that we are all going in the same direction, whether we like it or we don't. The truth of the matter also is that in an environment such as intensive care, people inevitably die. Let's quickly look at some facts and figures. According to most statistics, around 6 to 10% out of all patients admitted to intensive care pass away. In comparison, around 10% of all people admitted to hospitals die. That means that on average, more people die on hospital wards compared to intensive care. But let's not get too caught up in the facts, figures, and statistics. Even though end-of-life situations in intensive care are a frequent and regular occurrence, most of the time they are handled very poorly for a number of reasons. I'll give you some real-world examples so that you really understand. A previously fit and healthy 78-year-old man cycled around the block, collapsed because he had a heart attack. He got admitted to intensive care, where he never woke up again, as he also had a stroke during his ICU stay. The intensive care team suggested to the family to start palliative measures on this man as being quote-unquote in his best interest. So life support was removed and he was left to die over many days in an open cubicle in a very busy intensive care unit. The 78-year-old man and his family had no privacy, no dignity, despite empty side rooms, which means closed cubicles being available in the intensive care unit. On top of that, other awake patients and their families in the vicinity of this dying man also had to deal with the emotional scenes at the bedside. It took the intensive care staff a few days until the man and his family finally could find peace in a quiet side room in the intensive care unit. The worst about this situation, I found, was that the convenience to have this man in an open cubicle was more about the convenience for the staff and not respecting the needs, the privacy, and the dignity of a dying man and his family. Another terrible, undignified end-of-life situation in intensive care I witnessed was that a 58-year-old lady died over many months after she had received a lung transplant 2 years prior to her being readmitted to intensive care. She was left in the busiest and noisiest part of an intensive care unit. She was there in intensive care on a ventilator with a tracheostomy, struggling and fighting for her life. Everybody who had some common senses and everybody who had worked in intensive care for a considerable length of time knew that this lady would die. However, the intensive care team avoided the end-of-life discussions with this lady and her family. Both the 58-year-old lady and her family were in massive distress, and so were the nursing staff being involved with this dying lady, because the death topic and the discussions around the end-of-life process were clearly being avoided by the intensive care team for a number of reasons. And most of all, the family was suffering, which was evident in the poor body language the family displayed every time they visited their loved one. It was, in fact, a horrible situation to watch, and a cloud was hanging over the intensive care unit as everybody knew and could feel the tragedy unfolding in front of their very eyes, rather than getting this lady in a dignified and private side room and also start the discussions around the end of her life and how she would like to spend her final days. The intensive care team, of course, had other interests as well, such as continuing to get funding for this lady and also to continue doing medical research, especially with lung transplant. There is considerable evidence and research still to be gathered in order to find out how long people can live with a set of donor lungs. The lady, in her last 48 hours, was finally moved into a private and dignified side room and passed away there with her family at her side. Remember, this lady struggled over many months in intensive care on a ventilator with tracheostomy. Most surveys suggest that 75% of people want to die in their own home. However, only 25% of people actually die at home. Those are pretty compelling statistics if you ask me, and it goes to show that hospitals, governments, doctors and nurses are not paying any attention to what people really want. Thankfully, some alternatives exist already, even for intensive care patients. You can check out Intensive Care at Home for more information. That's intensivecareathome.com.au. And what about your peace of mind, control, power and influence in an end-of-life situation? Is the intensive care team having a good chat with you? Or are they just talking over you and not with you when it comes to the end of life of your critically ill loved one? Has the intensive care team asked you how you want the end of life situation of your loved one to look like? Has the intensive care team asked you whether you need more time or whether you have any special wishes? Has the intensive care team asked you whether you think that intensive care is the right environment for your loved one to die? Has the intensive care team spoken to your critically ill loved one if they are awake and conscious? Are you and your loved one fully informed about what and why things are happening? Did you know that some studies suggest that a change in the health situation of a family member is right in the top 10 of the major stress factors in life? Imagine that a change in the health status of a family member is in the top 10 of the major stress factors in life. There is no mentioning about critical illness or death in intensive care. It just says a change in the health status of a family member. That could be anything. It could be a flu, it could be a mental illness, it could be a broken leg. A change in the health status of a family member sounds pretty benign to me compared to a situation where your critically ill loved one is dying in intensive care. Therefore, you and your family need to have peace of mind, control, power and influence, because otherwise the intensive care team will just walk all over you and your critically ill loved one in this end-of-life situation. And you come out at the other end and you will have no peace of mind, no control, no power and no influence. And you will have negative memories, negative emotions and a bitter taste in your mouth. A negative end-of-life experience might stick with you and your family for the rest of your and your family's life. Therefore, with all my experience and after having worked with literally thousands of critically ill patients and their families in more than 15 years intensive care nursing, I give you a 5-step blueprint for dying well and with dignity in intensive care. Number 1. Make sure that you are involved in a transparent process. For example, has the intensive care team been transparent in their dealings with you and your family, and has there been open disclosure? Are you and your family actually under the impression that what you see is what you get? Or do you feel like the intensive care team has pressured you into withdrawing life support as being quote unquote in the best interest for your critically ill loved one? Make sure that before you agree into anything that could potentially result in the death of your critically ill loved one, that you have done your own research here at intensivecare-hotline.com. Also, check out this related article here, why you need to make up your own mind even if you're not a doctor or a nurse in intensive care. Number 2. Make sure that you and your family have a say about the end-of-life situation. I'm sure that if your loved one is dying in intensive care, you don't want it to be a process where you are a passive bystander. Get involved, have a say, and direct the end-of-life situation. That could be getting your cultural, spiritual, and/or religious needs met. It could also be a matter about timing. For example, do you need more time to grieve? Do you want certain family members to be there? Do you still need to wait for certain family members or friends coming in from overseas or from interstate? Make sure you and your family are not getting asked to quote-unquote switch off life support at a certain time because the intensive care team needs the bed for the next admission. Make sure you look at the situation from all angles. Also, check out this article. Make sure that your values and beliefs are known whilst your loved one is critically ill in intensive care. Number 3. Make sure you and your loved one get privacy, dignity and world-class care. The care you and your loved one are receiving in an end-of-life situation reflects the values of the intensive care unit. The care you and your loved one are not receiving in an end-of-life situation also reflects the values of the intensive care unit. If you are not treated with courtesy, dignity, respect, if you are not getting offered time for you to come to grips with things, if the intensive care team is not offering you a private side room, and if you feel like staff involved in the end-of-life situation have little or no experience, then you need to speak up. Ask for the best. Don't accept no for an answer, and if you don't get what you want, become difficult and demanding. It'll make all the difference and it'll give you peace of mind, control, power and influence. Also, check out this related article by clicking on the link below this video. 5 reasons why you need to be difficult and demanding whilst your loved one is critically ill in intensive care. Number 4. Make sure that it's not a rushed or hastened end-of-life situation, and take the time you need in order to come to make peace with the end of life of your loved one. I have seen far too many end-of-life situations in intensive care that were rushed or hastened because the intensive care team put pressure on the families to free up the bed as quickly as possible, as they had other admissions waiting for the ICU bed. You and your family need to be strong. You need to turn things around in your favor, and you need to start managing the intensive care team and not the other way round. Remember, this is your situation. This is your time to have peace of mind, control, power and influence. This is all about you, your family and your critically ill loved one. Make sure you don't get this once-in-a-lifetime situation wrong. Number 5. Consider your loved one dying at home as a real possibility. I have stopped counting how many people have asked during end-of-life situations in intensive care whether they can take their loved one home. Remember those statistics from earlier? 75% of people want to die at home if given the option. The question is, are you giving your critically ill loved one the option? You know exactly that you have more peace of mind, more control, more power and more influence if your loved one is approaching their end of life in their own home. Are you and your family making sure that this once-in-a-lifetime situation is truly directed the way you want it to happen? Again, check out intensivecareathome.com.au for more information if you want to have your loved one dying at home. So, how can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.